Thanks for watching this video on sore throats. Joined today again by Jason Carney. Hi Jason.
Hi Tim, how are you?
Yeah, really well, thanks. Sore throats are very common. Tell us a little bit about what symptoms you might experience with a sore throat.
So it's pretty simple and sort of explanatory. You find it hard to swallow any food. You're difficulty sort of swallowing some of your saliva, or it's irritated when you're trying to eat or drink anything like that at all. And that can be in varying degrees, so it can be quite mild all the way through to not being able to tolerate anything at all.
Yeah, and often it's one of the most common causes of why kids reject fluids, especially babies who can't talk to us and tell us why they don't want to drink their bottle anymore. You look in the throat, they've got big red swollen throat, and a bit of Panadol and Nurofen usually fixes that up. So what sorts of things can patients do for themselves or their family at home? So
majority of sore throats can actually be managed at home. They don't really require assessment. So plenty of fluid if you can, simple pain relief, some Panadol, some Nurofen when indicated, some over-the-counter medications also from pharmacists, some gargles, just rest and trying to maintain your fluid so you're not getting dehydrated.
Yeah, so dehydration is probably one of the most common complications of a sore throat. So symptoms like dizziness, headache, fatigue, and usually darker coloured urine. So if you're worried about dehydration, then that would be the point at which you could call us or come into the clinic, and we can offer specialist-led medical assessment, associated swabs or blood tests as required. And then what sorts of treatments might we give these patients if they're significantly dehydrated?
Yeah, so you may need some strong analgesia, so some pain relief. Also, if you're getting dehydrated, need to give you a drip and some intravenous fluid. Just trying to replace some of the electrolytes you may have lost if you're not tolerating food or fluid as well.
Yeah. And there are some red flags with sore throats, of course. When does it get really bad? When might you need to go to the emergency department?
Yeah, so if the symptoms aren't settling down over a period of time, there can be an abscess formation around possibly the back of the throat around one of your tonsils. That definitely needs to go to hospital. Or if you're feeling like you've got breathing difficulties, you can't breathe, I feel like your throat's closing over, you can't swallow any of your sort of saliva, then you should go to an emergency department.
Yeah, so voice changes, breathing difficulties, and unable to swallow your own saliva, you should be in an emergency department. Everything else, either manage it at home, or if you're worried about dehydration, come in and see us. Thanks so much for watching the video. Like, follow, and share to see more educational content like this. And our videos are also posted on the website, so you can check them out there.